Hi, I'm John Kanellopoulos from Athens, Greece and New York City, New York. Eye surgeon, clinical professor of ophthalmology at NYU Medical School in New York. Our group, based here in Athens, Greece, is well known for its contribution in treatments of keratoconus and post-LASIK ectasia. We have been working with a high-frequency ultrasound, the Artemis unit, over the last year, and we ran into what we believe is a very, very important finding presented herein. We found out that although, as it is known and published in the past, ectatic corneas appear to have thicker epithelium over the area of the ectasia, the overall thickness of the epithelium in these eyes is much thicker than in normal corneas. And this corresponds also when comparing these eyes with similar eyes that have been cross-linked before. The epithelium in ectatic eyes that have not been treated is much thicker, the overall epithelium, than eyes that have ectasia that have been cross-linked. Now, this is a very important finding because in an era where corneal thickness will be very easy to attain from OCT, anterior segment OCT devices, we could simply look at a pachymetry map of a cornea and have a very early sign of ectasia. We theorize that this epithelial thickness is a reaction to the change in biomechanical behavior of the cornea. Probably this cornea pulsates more with the heartbeat pulse drawn through the body, reacts more to eye rubbing or even blinking, and this injurious effect to the epithelium probably causes epithelial hyperplasia and thus a sensitive sign of a cornea that is not biomechanical stable. Obviously, larger and longer term follow-up to this theory need to establish this diagnosis, and I hope you find the presentation of the data of this work interesting. I thank you very much for your attention. So I'm very pleased to present to you the data. These are my financial interests of this study. We try to correlate the epithelial thickness with a high-frequency ultrasound in normal, keratoconic, and eyes that have been previously treated with collagen cross-linking. We use the Artemis device, and we found that when looking at mean, central, and transitional zone thickness, as you can see here, there was a statistically significant P0005 of the ectatic corneas being thicker. This is a table showing the different thicknesses. This is, again, thicknesses and standard deviation. This is more description of the data. And again, mean, central, and peripheral epithelial thickness. This is an image of the Artemis high-frequency ultrasound and a map in a normal eye. This is the scattergram showing the epithelial thickness, and here the thickness of a normal eye and a ectatic eye. These are the areas that we sampled, and you can see here, this is a very dramatic slide, control, keratoconus not treated and treated eyes, and the significant difference in overall epithelial thickness. Again, another example, epithelial maps with the Artemis. These are some cases that we have treated with collagen cross-linking with the Athens protocol. As you can see here, topography guided removal of the epithelium and collagen cross-linking with 7 milliwatts for 15 minutes. And again, here is a case example of overall epithelial thickness in an eye before and after cross-linking, and another eye here. This is before and after cross-linking, and how after cross-linking the epithelium became normal. So highly irregular epithelium is suggestive of ectasia and probably a new diagnostic